I'm a career changer. I previously worked in finance. I had an experience where my father got quite ill. And during that time, I fell in love with the profession of medicine, the know-how that his doctors demonstrated to work towards a diagnosis and work towards getting him well again. I really got excited about minimally invasive surgery. It's still a frontier specialty within general surgery, and it's constantly evolving.
Buildings don't make hospitals, people make hospitals. The most important factor when looking for a fellowship is finding the people that you are going to glean the most from over the course of a year. I was a fellow here at Mount Sinai before I became an attending, and I think that the thing that makes this fellowship great is the people that you're going to be learning from. The fellowship here is really designed to create technically excellent surgeons who are going to be leaders in the field in the future.
Founded in 1992, our fellowship is one of the first training programs in minimally invasive surgery in the United States. We provide our fellows with an exceptional variety of cases in both general and bariatric surgery using laparoscopic and robotic surgical techniques, with a remarkable volume of gastric bypass, sleeve, and revisional procedures.
I think one of the biggest things that prospective fellows look for is when you're looking at bariatric programs is that you're going to meet your numbers to get an ASMBS certification, and you will meet those numbers with ease in this program.
Our fellows have a unique opportunity to build their surgical skills in two different clinical settings, spending 6 months at the Mount Sinai Hospital in the heart of Manhattan's Upper East Side, and 6 months at Mount Sinai Morningside, just across Central Park.
This is a good balance of bariatric, probably about 50% bariatric, and then the rest being rounded out pretty evenly between foregut surgery, so doing your paraesophageal hernia repairs, getting comfortable with endoscopy, then abdominal wall reconstruction, quite a bit of inguinal and ventral hernia repair. We're the only MIS program in the country where we also do the donor nephrectomies for our transplant surgeons.
From day one, my first day was in the operating room with Dr. Heron, and we had a gastric bypass, and he basically just put the instruments in my hand and said, okay, let's see what you can do and see how far you can get. And I did the whole case.
We have a good mix of attendings, and all are willing to serve in advisory roles, whether that's deciding about how you want to do a certain operation, deciding how you want to deal with certain complications. There's no coddling here. You sometimes have to navigate difficult situations, and they give you the autonomy to do that.
I think mentorship is the most important thing of being in a fellowship. We all, as educators, really try to strike that balance where you give the fellows a chance to stretch their wings a little bit and learn how to command an operation, but also getting the coaching and the guidance that they need. How much you're able to do, it depends just entirely on what you feel comfortable with, what you're capable of. You get to kind of choose your own adventure with the types of cases that you get to do.
You do have a lot of say in shaping your experience in the fellowship and fine-tune your curriculum to what you want to work on. Basically a series of aha moments when you start to figure out how you're going to do the case, and you're picking and choosing things that you've seen your attendings do. That's an exciting time in the fellowship.
We also offer unlimited opportunities for research and collaboration with other subspecialties, making our program a well-rounded place to train and develop outstanding surgeons.
When a fellow graduates from a program, they're going to have excellent surgical skills, excellent decision-making skills, whether it's in the hospital or in an outpatient setting. It's just really satisfying to see people making a name for themselves once they leave this place.
What I can say confidently is at 6 months, I feel ready to operate independently and autonomously and ready to go out in the world. That would be the number one thing I'd ask for a fellowship, and Sinai's delivered.